Hello, everyone. In this question, we have a 58-year-old with a 7-month history of epigastric intermittent abdominal pain that radiates to the back. The pain worsens with eating, and the patient also has a 30-year history of cigarette smoking, and he has also been drinking 7 to 8 beers a day for the last 20 years. Now, right off the bat, this is going to be a classic presentation for chronic pancreatitis. In question stems, they'll give you someone that has a history of um, alcohol use for many years, and then they'll be presenting with a abdominal pain that has been going on for a while. So this person has been experiencing abdominal pain that is epigastric that radiates to the back for the last 7 months, and they'll also tell you that the pain is going to worsen with eating, and we'll go over the pathophysiology of this. Now, when we take a look at the labs, we see that the lab markers are all normal relatively. So the lipase is going to be 30, which can happen with chronic pancreatitis. With acute pancreatitis, we'll see the lipase levels being abnormally elevated. Now, the CT scan shows pancreatic atrophy as well as multiple calcifications in pancreatic parenchyma. MRCP shows non-dilated pancreatic duct without intraductal stones. Now, right off the bat, when we take a look at this information with the MRCP, because there's non-dilation of the pancreatic duct, we know that there's no obstruction going on. So because of that, we can immediately rule out pancreatic surgery and ERCP because there's no obstruction. As a result, we don't really need to remove anything through surgery, or we don't need to scope the patient. Now, the question is asking, what is the best next step in management? Now, answer choice A is long-acting oxycodone for treating pain in chronic pancreatitis. Oxycodone or other opioids are not going to be the first-line options. The first-line options are going to be non-opioids like tricyclic antidepressants like amitriptyline. So we can also cross out answer choice A. Now, we're going to be left with answer choice C, which is going to be the correct answer, which is lipase supplementation. Now, the reason why we want to give lipase supplementation to patients who have chronic pancreatitis is because when we consume food, for example, it's going to go to our stomach and then it's going to reach our duodenum. So the fat is going to reach the duodenum from the food that we eat. And so this fat is going to then stimulate the eye cells that are found in the duodenum to release CCK. And CCK is then going to, so let's write CCK. So once fat from the food reaches the duodenum, the eye cells in the duodenum is going to release CCK, which is then going to go to the pancreas and stimulate the pancreas to produce enzymes. Now, these pancreatic enzymes, once they go into the duodenum, they're going to stop the production of CCK. So they're going to get rid of this enzyme so that the pancreas does not get stimulated with CCK. So it's basically a feedback system where once we have this fat reaching the duodenum, it's going to cause the eye cells to release CCK, and then CCK is going to stimulate the pancreas. Pancreas is then going to secrete enzymes, and then it's going to get rid of the CCK so that the pancreas does not keep stimulating. Now, in chronic pancreatitis, because there is inflammation of the pancreas that goes on for a long time, the pancreas is now not working properly. So because of that, there's going to be death of cells in the pancreas. And so now we're not going to be able to properly produce pancreatic enzymes. Now, because we are not able to properly produce pancreatic enzymes, once we eat and fat reaches the duodenum, and once the eye cells in the duodenum produce CCK, it's going to keep on stimulating this inflamed pancreas. And so that is going to cause pain. And that is why patients with chronic pancreatitis are going to experience pain after meals. So this is going to be a classic presentation for patients with chronic pancreatitis. When they consume meals, their pain is going to get worsened. And the reason for this is because once the fat from the meal that they consumed reaches the duodenum, it's going to cause the eye cells in the duodenum to produce CCK, and this CCK is then going to stimulate the inflamed pancreas, and so that is going to cause pain. Now, if we give lipase to these patients, it's going to then relieve the pain because now we're giving them lipase, which is going to then get rid of the CCK, and now this pancreas is not going to keep stimulating, and as a result, this is going to relieve pain as well as help with the digestion of food. So to answer the question, lipase supplementation is going to be the best next step in management, and we can also decrease um, fat in meals to help patients with chronic pancreatitis because if we decrease the fat in meals, now the eye cells in the duodenum are not going to be stimulated to release CCK, which is going to then stimulate the inflamed pancreas. So that is another option in treatment is going to be to reduce the fat that is consumed in meals.